Suboccipital muscles are very, very important because of the relationship of the occiput to the atlas. So one of the ways that we're going to release the suboccipitals, rather than just randomly digging in the posterior occipital atlantal membrane, which is right in here, this soft spot, you never want to just be doing random work in the posterior occipital atlantal membrane, because why? Cranial nerves, vascular, you've got the vertebral artery pumping up through there. You've got spinal nerves, so you want to stay out of that area. So what you do is the first thing you do when you're going to work suboccipitals is locate the spinous process of C2. So you go to the lowest bone on the head, which is the inion. Find the lowest bone on your head, the inion, and then you drop down and you've got a hollow space. That's where the spinous process of the atlas vertebra would be if there were one. Instead, you go right below it and you will find, if you ask them to move their head around a little bit, you'll locate that spinous process of C2. C2 is the most important vertebra in the neck because of its transitional forces that connect from below and above to the cranium. And so we want to always use that as a landmark. So the first thing I do is make sure I know where I am when I'm doing suboccipital work, and make sure it's not just some random deep tissue release in there. So I find C2. The places that I want to go with the C2 is, first of all, I want to go straight up, a little bit to the right, and to the base of the skull. I'm right there at the base of the skull, and my thumb is pointing that direction toward the table. And that is what muscle? Rectus capitis posterior major. That is the major head extensor, head on neck extensor. So then I just want to come right next to it with my other thumb. And what muscle am I on now? The rectus capitis posterior minor. Now, if this rectus capitis posterior minor is tight and fibrotic, then you definitely want to get in here and do this work. Sometimes, however, it is flaccid, weak, and has no tone at all. You have to be careful because it does attach into the dural membrane, and so we want to make sure that we do not loosen it, try to release it if it's already flabby. So we go in and I'm on his right side, the rectus capitis posterior minor, rectus capitis posterior major with my right thumbs pointing toward one another. I get my left elbow braced against my body, and then my hands are around his head, so I'm securing his head because I'm going to ask him to gently cock his chin up, lift his head up. And when he does, he fires the suboccipital muscles, and I resist to a count of 5. 2, 3, 4, 5, and I ask Luke to cock his head back again. 2, 3, 4, 5, and relax. And when he does, I take up the slack, put him into a little more flexion, because that's what they're doing. They're extending the head on the neck, and we want them to release and allow for a little flexion to get rid of the forward head postures we see in our society. Now I just move along the occipital ridge. I'm getting splenius capitis, semispinalis capitis, longissimus capitis, of course, is hidden underneath the sternocleidomastoid attachment over here. We're going to get that too, though. But I just slide along and ask Luke to just lean back against me. He'll feel my efforts where my force is, and he'll just push back against me, and I resist. And then when he relaxes, post-isometric relaxation, and we just loosen the muscles. As they stress, the Golgi tendon organs are under tension. And what does a Golgi tendon organ do when it's under tension? It resets its own muscle length. It not only resets its own muscle length, but it also resets the muscle length of its synergistic stabilizers. In other words, all the other muscles that do the same action. And it also facilitates its antagonist. So anytime you're doing Golgi tendon organ work, it not only helps release the muscle, its own muscle, but it's also the other muscles that do the same job along this occipital ridge that cause the forward head posture. And it also strengthens the antagonist muscle. It facilitates or strengthens the muscles that are weak on the other side.